Hey there, friends. It's Pharmacist Michael. Let me ask you something. Have you or someone you love been told your heart isn't pumping the way it should? Maybe you've heard words like reduced ejection fraction or congestive heart failure, and you're feeling overwhelmed by the medical jargon. Well, today I'm here to break down one of the most powerful medications used in heart failure treatment, Entresto. It's not just another pill. This one's been called a game changer. But how does it work? Who should be taking it? And what are the side effects you absolutely need to watch out for? Let's make sense of it without the fluff. Just real talk from a pharmacist who's seen the difference this drug can make. Entresto is the brand name for a combination medication. Sacubitril, valsartan. It's used to treat heart failure with reduced ejection fraction, or HFrEF. That basically means the heart's left side isn't pumping out blood effectively. Now, why is Entresto such a big deal? Because it doesn't just manage symptoms, it actually reduces the risk of death and hospitalization in people with chronic heart failure. That's huge. Entresto has two parts working together, like a tag team. Valsartan, an ARB, which is an angiotensin receptor blocker that relaxes blood vessels and lowers blood pressure, and sacubitril. This is the unique part. It blocks an enzyme called neprilysin, which helps your body retain natriuretic peptides. These peptides get rid of excess salt and water, relax blood vessels, and reduce strain on the heart. So you get improved blood flow, less fluid buildup, and your heart doesn't have to work so hard. It's like taking the bricks off your chest. Now let's talk about the stuff nobody likes to think about, but really needs to know. The side effects and risks of Entresto. Because while this medication can be a game changer, it's not without a few bumps in the road. The most common side effect? Low blood pressure, or what we call hypotension. Entresto relaxes your blood vessels to reduce the strain on your heart, but that also means your blood pressure can drop too low, especially when you stand up quickly. This can cause you to feel dizzy, lightheaded, or even faint. I always tell my patients, if you're getting up from a bed or a chair, take it slow. Sit on the edge for a minute before standing. Another one to watch for? Elevated potassium levels, also called hyperkalemia. Potassium is essential for heart rhythm and muscle function, but too much can be dangerous, even deadly. It can cause muscle weakness, nausea, or in severe cases, even abnormal heart rhythms. So if you're taking potassium supplements, salt substitutes with potassium, or other drugs that raise potassium, like spironolactone or ACE inhibitors, make sure your doctor knows. Then there's the impact on kidney function. Entresto can sometimes reduce how well your kidneys filter your blood. That's why your doctor will want to check your kidney function regularly, usually with simple blood tests like BUN and creatinine. If you already have kidney disease, this is especially important. Now, here's a rare but serious one. Angioedema. That's sudden swelling of the face, lips, tongue, or throat. And yes, it can become life-threatening if it blocks your airway. If you feel your face swelling, or you're having trouble breathing after starting Entresto, get to the ER immediately. Don't wait. Call 911. This risk is higher if you're African American or if you've had angioedema in the past. And here's a big point I want to drive home. If you're currently taking an ACE inhibitor like lisinopril, enalapril, or ramipril, you must stop it at least 36 hours before starting Entresto. Why? Because combining an ACE inhibitor with sacubitril increases your chances of getting angioedema significantly. Other, less common side effects can include cough, though less common than with an ACE inhibitor, fatigue, nausea, and in rare cases, renal failure, especially if you're dehydrated or on other meds that affect the kidneys. The bottom line, Entresto is powerful, but it needs monitoring and respect. You'll need regular blood work, and you should report any unusual symptoms right away. Think of it like driving a sports car. It can take you far, but only if you know how to handle it properly. Entresto is typically prescribed to people with HFrEF, especially those with NYHA class 2 to 4 heart failure. It can be used as a first-line option or as a switch if your current medications aren't working well. But there are some people who shouldn't take Entresto. If you've ever had angioedema with an ACE or ARB, if you're pregnant, because Entresto can harm unborn babies, if you're severely hypotensive or have significant kidney problems without close monitoring. So this isn't something you just grab off the shelf. You need regular labs, potassium, kidney function, and blood pressure monitoring. All right, let's talk about science real quick, because the story behind Entresto isn't just hype. It's backed by one of the most influential heart failure studies of the last decade, the Paradigm HF trial. Now, I know clinical trials can sound dry, but hang with me. This one's a big deal. In Paradigm HF, over 8,000 patients with chronic heart failure and reduced ejection fraction were studied. These patients were randomly assigned to take either Entresto or a traditional ACE inhibitor, specifically enalapril, which was the gold standard at the time. And the results? Entresto blew expectations out of the water. Compared to enalapril, Entresto reduced the risk of cardiovascular death by 20% and cut heart failure hospitalizations by 21%. Think about that. 20% fewer people dying from cardiovascular causes and 21% fewer winding up in the hospital because their heart failure worsened. That's not just a statistical blip. That's real lives saved and real families spared a crisis. But here's where it gets even more interesting. The trial was so successful, it was stopped early because it was considered unethical to keep patients on the inferior treatment when Entresto was showing such a dramatic benefit. That almost never happens. Because of this, Entresto is now front and center in heart failure treatment guidelines. The American College of Cardiology, the American Heart Association, and the Heart Failure Society of America all recommend Entresto as part of guideline-directed medical therapy for patients with HFrEF, often even before starting an ACE inhibitor or ARB. So when I say this drug is a game changer, I'm not exaggerating. This is one of the few medications that can truly extend life and improve quality of life in heart failure. That's the kind of data we dream about in medicine. Here are a few pharmacist-approved tips if you're starting Entresto. Start low and go slow. Your doctor may begin with a lower dose to see how you tolerate it. Stay hydrated, but not too much. Fluid balance is key in heart failure. Avoid potassium-rich salt substitutes, unless your provider says otherwise. Check blood pressure daily, especially during the first couple of weeks. Keep your follow-ups. Labs are crucial to catch any early problems. Entresto isn't for everyone, but for the right patient, it can be life-changing. If you've been prescribed Entresto, or you're wondering whether it's an option for you, talk to your cardiologist or primary care provider. And as always, ask your pharmacist if you have questions. Your heart deserves the best care, and you deserve to understand your options. If you found this video helpful, give it a like, hit that subscribe button, and share it with someone who might benefit. And let me know in the comments, have you or a loved one used Entresto? What was your experience like? Until next time, I'm Pharmacist Michael. Stay healthy, stay informed, and I'll see you in the next video.